everybody, and welcome to the No Hair, All Heart podcast. I am your host, Mookie Spitz, and I am the one with no hair. And our guest today, who is all heart, is Dr. Alex. She is a doctor of acupuncture. And part of her professional goals is to unite Eastern and Western medicine to bring out the best in each to give patients that extra option for their care. I hope that sets you up, Dr. Alex, with enough you need to succeed. Tell us a little bit about yourself, how you got into acupuncture, how you've transformed it into a viable career. I think many people listening might not even know that acupuncture is a science, that it's legit medicine, and that you're actually a practicing physician in California.
Yeah, hi. Thank you so much for having me here. I'm excited to talk about acupuncture. So, yeah, I started very young as a patient. My first acupuncture treatment was when I was 12 because I was a competitive swimmer and I couldn't breathe through my nose, spending so much time underwater. So, I started using medication to unclog my nose. And I started to become a little dependent on that. Every time I had a sleepover and I would forget my medication, I wouldn't sleep because I couldn't breathe through my nose. And I started to get a little worried about that dependency. And I mentioned it to my mom. And my mom has always been into alternative medicine or natural methods, along with Western medicine. And she knew a wonderful acupuncturist in Caracas. I'm from Venezuela originally. And he was actually from Peru, but living in Caracas. And she took me there for about 3 sessions, and he did some acupuncture and he used some pressure point machines. And my nose issues were resolved in 3 sessions. And I was like, wow, I want to be like this dude. I was just amazed that without any medication or injections, which a lot of people think needles, acupuncture needles, have liquid in them, um, I was completely off the medication and I never had issues with my nose again. So growing up, I always had that in the back of my mind. And I was in school when I was in college. I was in psychology school and then I was pre-med. But I decided to, instead of going to medical school, to stick with clinical psychology because I really enjoyed the connection with patients and spending time with them. And when I was time to do my PhD in clinical psychology, I remembered the story about how cool acupuncture was. And I started looking for schools. And I found a school in many different states, but I found one in San Diego that offered a master's in Chinese medicine and acupuncture, and later on, um, an option to be a doctor in acupuncture. And I was like, this is it. This is perfect. It is part med school, Western medicine, because we had so much training in Western medicine, pharmacology, anatomy, physiology, orthopedic neurological evaluation. But we also had the Eastern medicine modality, which was acupuncture and Chinese herbs and nutrition. So I applied and I got in and I packed my car and traveled cross country from Ohio to San Diego and started my journey into becoming a doctor of acupuncture. And it was the best decision professionally that I could have done. So long story, but that's how I got into it.
So it sounds like a childhood experience of actually being on the receiving end of acupuncture as a patient convinced you vividly that it actually works, that the efficacy of this Eastern procedure was real. And as you got older and you were looking at viable career options, sounds like you had an interest in healing and health. You had this vivid experience top of mind. You explored it and you dove right in.
Yeah. I always thought that was, even as a kid, definitely psychology and counseling was in my interest because I love talking and I love listening. But what I really appreciated from my doctors, including my acupuncturist, was when they were like actual physicians, where they will like do an evaluation by touching your arm or your leg and like actually feeling how your body feels like, or what they can find through their palpation, observation, inquiry. And my acupuncturist did that and figure out where in my body there was a dysregulation. And I was just so amazed by that, especially being dependent on this medication, which was a decongestion, something that you can get over the counter, nothing fancy. And I was just, that really made an impact to me when I was 12.
Well, that's impressive. What's also impressive, and I think is an eye opener, probably to most folks listening, as I was mentioning, that acupuncture is viable. You had your personal experience of it working. The Chinese, of course, and many countries in Asia, many cultures in Asia have been actively practicing acupuncture for centuries, for millennia. And for lots of complicated reasons, the divide between Western and Eastern medicine has been significant. And I would think over the last 10, 20 years, acupuncture has become increasingly seen as legitimate, as viable, and to your point, is becoming integrated into Western healing. Why do you think there's been this much hesitancy? And do you encounter hesitancy on the part of patients about the practice? Is there still lingering mystery and skepticism about the efficacy of acupuncture? Or do you feel that it's reached the point, at least in California, at least in Southern California, that it's seen as viable, legitimate, and welcoming?
Yeah, that's funny you ask because sometimes, and still to this day, I have a patient in front of me already booked for their appointment, and they ask me, "Does this really work?" So I'm like, "No, I'm just gonna rip you off."
Right.
And I'm like, "Of course it works." And I feel the hesitancy comes from misconceptions and fear. People in general don't like needles. They associate needles with pain. And most people don't like injections or having their blood drawn. So they are so scared of needles. It's just it's like a primal fear of being pinched.
Yeah, I have my personal experience. My first exposure to acupuncture was must be 30 years ago. And again, I'm giving away my delicate young age. And it was a date. I was on a date with a professional acupuncturist in Chicago, not the most enlightened of cities at the time, especially with regard to alternative medicine. But she was a practicing acupuncturist 30 years ago. And I asked her the same question. I was over at her place and I go, is this does it really work? So she took out one of her needles and she said, hold out your right arm. And I said, okay. And effortlessly and instantly, she made my entire arm from the elbow down completely numb with one quick motion. So I think that was her vivid demonstration of its efficacy. Did I need treatment? No, but she managed to convince me pretty rapidly that acupuncture does have an effect on the body.
That's
So
wonderful.
yeah. So I was convinced, and I've been convinced for 30 years. But to the listeners, can you describe, at least on a high level, how it actually works? Why would the body be receptive to these needle pinpricks in a way that it would alter the body's reaction to itself and even reaction to foreign agents. How is it that you can apply needles in certain parts of the body to reduce symptoms, to treat disease, to ostensibly heal people in a way that's just so radically different from what most people are used to?
Definitely. No, I'm glad you're asking. It's not an easy question to answer and also keep a straight line. And I think that also keeps a hesitancy because of the difficulty of actually explaining. So through my years in practice, I've been in practice for 8 years. I kind of make explanation that maybe will make more sense. So there's still a lot of research to really pinpoint the more scientific way to explain how acupuncture works. But basically, we are using connective tissue in the body, more specifically fascia and blood, for two goals. Another misconception before I go into the goals is that we're needling nerves. We're not. If we were needling nerves, that will hurt a lot and nobody will allow us to put needles on them ever. So we are changing with connective tissue movement the environment where the nerves are residing. So sometimes that environment can be not nutritious enough. So we're changing that environment by promoting circulation. So there's two goals. One is by, in the specific parts of your body, stimulating a area or a point to give your nervous system a message, because the needle going inside the skin or through the body, that is like a micro tear that the nervous system is picking up. So different parts of the body will create different messages in that micro tear. So your nervous system will respond to that, whether increasing circulation, increasing a neurotransmitter or hormone release, or decreasing something. And the other goal is to, in the local area affecting the muscles and tissues around, whether it is to relax it or to strengthen it. And through circulation, we also nourish muscles and organs. So we're basically moving blood. That's all we're doing. And that, if you think about it, blood in our body has a lot of the components that heal our body. It has oxygen, food, neurotransmitters, hormones. Like that is the way of our body to nourish itself. So that's why we study different areas in your body to have an effect on the circulation and the nourishment of your body, and that will create a natural response, your body natural ability to heal itself. We're just helping realizing where it's lacking or overproducing.
So in summary, when a thin needle enters someone's body and it's relatively painless, sometimes entirely painless, right? Because to your point, you're not directly impacting the nerves, but the surrounding tissue. When these needles enter the body, they create this micro tear, but it's a disruption. It is a triggering of the body at that point in the body, which in turn stimulates blood flow, other kinds of responses in a complex, varied way that can engender the results that you're looking for. Is that more or less what I'm hearing?
Pretty much, yes, you got it.
Oh, okay. And what's interesting, and this is what fascinates me too, some of it is odd and counterintuitive. For example, I've seen procedures where an individual will receive acupuncture in their left ear to treat stomach ailments.
Mhm.
So what's fascinating to me is the body's manner of communicating with itself and how the body, various tissues and various organs are connected and integrated in these subtle implicit ways that in a sense become revealed through acupuncture. So if you poke someone's left ear, then it might have an impact on their stomach, or and again, I'm not aware of the exact details and relationships, but strategically, this to me is fascinating, how the different parts of the body are connected in ways that are not obvious, and really are just a matter of experiencing the needles for yourself, if you will.
Yeah, and that's the beauty of our the body that we have. We are not a single pathway, single muscle working alone. We are an organism, and everything, not to be cliche, but everything is connected. So we have this beautiful nervous system that is all over our body. It's like a tree branches that keeps branching. And then we have a connective tissue around all a big connective tissue, which is blood, and then we have a saran wrap around all our organs, tissues, that is fascia, which is being now researched thoroughly because there's so much in there. So even if you put a needle in your ear, there are pathways that are shared in you through your nervous system onto your spine and to your brain. So you don't really need to needle your stomach directly, but you can use other pathways, and with that, accessing other properties of your body. So it's using their body's own map, that it's not solely made of one highway. Everything's connected. And we spend years studying these pathways, and that's what you're saying is the way how acupuncture started happening. When back in the day, like thousands of years ago, people realized that if you massage the outside of your arm, your stomach felt better,
Right.
or you
Right.
were less constipated. So doctors were really interested about this, because how does the arm has anything to do with going to the bathroom? And then they started to be so curious that the points, they started to narrow it down to areas that became trigger points. And then the acupuncture, the needle, became the technology that did that micro tear, and created a faster response. So it's
Yeah.
fascinating.
Fascinating, and it's tragic in the sense that these insights have taken so long to filter into what ostensibly could be considered a more physicalistic and deterministic and linear way of thinking in the West. So in the East, everything from philosophy to medicine is seen as synthetic in this kind of way. The body is all connected together. You rub the arm, it'll have an impact on an organ, and there's this feeling of connectivity. Whereas in the West, it's almost more transactional in the sense of you make an impact in one area of the body, and of course you'll focus on that body. And if you have a symptom, then there's just a micro focus on that symptom, and there isn't the broader consideration of the human being as its own complete organism. And I think that that's been endemic in Western thinking, going all the way back even to Leonardo doing the anatomical sketches, right? It's like you have an organ, and the organ does something, and then another organ does something different. And once you figure out what the different components of the body do, then in order to heal the body, you just focus on that component.
Right, right. Yeah, which has its benefits also.
Of
Uh,
course,
that's
right.
why I love both. I love both Western and Eastern medicine, because I think together we are like the most through like complete medicine for the benefit of our patient, to get better. And I think when I was studying acupuncture, and I was studying Western medicine and Eastern medicine at the same time, Western medicine as my background, because you need to know the anatomy, physiology, everything, pharmacology, everything. You need to know it before you put a needle in someone. But also studying the way the Eastern doctors saw it, I was like, we are not so different. How can we be so different if we're studying the same organism? We are just speaking a different language.
Yeah, I think that this is long overdue. So, how do you put it into practice? Describe your your setting as a provider, as a practitioner, and once again, you have a doctor of acupuncture practicing medicine. And
Mm.
this probably comes as a surprise again to many people who would consider it alternative to the point where it's not actually certified and official.
Right.
So can you give us a little background? I mean, are all states now looking at all states within the United States considering acupuncture in the same way that California does? Is there variability? Is there a different sense of legitimacy and application depending on where you are?
Yeah, yeah, definitely. Well, there's a few states that are not allowing acupuncture to be practiced legally. There's maybe three or four. There,
Okay.
there is a national accreditation institution that most states require. And some states, like California and New York, and I think Florida and many other states, require not only the national certification, but also a state certification. So that is an exam that evaluates your knowledge of Western and Eastern. And then once you pass that exam, you have a license to practice acupuncture legally. We are not considered medical doctors, and we're not. It's a different. We're not MDs. We are doctor of acupuncture and Chinese medicine, which that determines our scope of diagnosis and practice. We cannot prescribe medication anywhere in the United States. I think in Florida is the only state where acupuncturists can inject and use injections, but California doesn't allow it. But other than the clarification of pharmaceuticals, not prescribing pharmaceuticals, and not being considered a medical doctor, we are physicians or we are considered health providers. So,
Okay.
yeah.
And how do you provide health within this broader context? So are you part of an institution, a hospital? How does it work in terms of plugging you in to the healthcare system?
So I've been in private practice for the last 7 years, and I have my own office where my patients come in and I treat them with a full scope of acupuncture and Chinese medicine. And I'm a general practitioner, so I see it's similar to family practice where I see a um, the broad spectrum of health, and then if they need a specialist, I can refer. So in private practice, it depends. You can come in for anything from digestion to hormonal balance, stress, or pain, like physical pain. And I will treat that with acupuncture, lifestyle changes, nutrition. And now I started working in a health center in San Diego, where I'm considered an acupuncture provider, but I work in the physical rehabilitation department. So most of the things I'm treating right now is pain. Anything from headaches to musculoskeletal pain, arthritis, joint pain. And I think within the health system institution, more where the MDs are, this is where acupuncture is needed the most. Mhm.
Okay, so it sounds like you have a very specific focus in terms of your healing. So it's not just general medicine in the sense of everything that a PCP does. So a PCP will obviously prescribe insulin or its variants for diabetes. If it's an endocrine problem, they address all sorts of other issues. It sounds like you have a particular focus, and within your particular practice right now, it's primarily pain focused, inflammation, pain, that kind of
Mhm.
thing.
Yes, exactly. This is at least where I'm working right now in the health center. This is like my scope is pain. Where I still have my private practice where I focus on everything. So I do like to work, everybody has a primary care, and I do like to work alongside so I can see the blood panels or any hormonal testing that we need to know. Because sometimes my goal is never to get patients off a medication if they don't have to, but if their doctor and I can work together so they can switch to something different or a lower dose or a more natural approach, then we will do that as well.
Now, I'm guessing listeners would be intrigued about acupuncture, likely as a plan B. So typically, patients are struggling with something, so they might experience even chronic pain. And we've obviously had and continue to have a horrific opioid epidemic,
Yeah.
triggered often by people who are simply treating or trying to minimize their pain after a surgery. They have a back problem, they have some kind of joint ache. And the opioids have been a very unfortunate pathway for trying to mitigate their suffering regarding pain. What you describe is a viable, different option for pain treatment that I would bet again, not that many people consider. And it is completely drug free. You're not
Yeah.
prescribing any drugs. You can't prescribe any drugs. And from what you're saying, it displays a proven degree of efficacy, which keeps you in practice and which keeps other physicians happily referring their patients to you for acupuncture treatment. Is that correct?
Yes, I mean, we are booked in the acupuncture department. We need more acupuncturists. We have a
Yeah.
flooding of patients because people are getting better. But I think the misconception and what my goal is right now is to educate people about the acupuncture as an option because, yes, we are the plan B. Sometimes we're the last resort where we should be the first or second contact when it comes to pain. And if acupuncture lifestyle changes are not working, then alongside these treatments, maybe prescribing a mild analgesic or an anti-inflammatory instead of being the last resort. And sometimes people come to acupuncture and say, "Why didn't I do this earlier?"
Right.
Another thing that happens is like once your doctor prescribes medication for pain and does the surgery that you might need, there's nothing else they can do for you. That's it. So we are a great resource for physicians because then they can say, physicians care about their patients, so they can say like, you know what, I can't do more, but there is this option that will maintain your pain at a minimal and you will be at maintenance at a lower cost in a natural way. And patients love that.
So it sounds like there's intriguing opportunities from both directions, if you will. As a first line therapy, acupuncture is immediately viable. And
Mhm.
since it's non invasive, aside from just the needling for a few seconds, there's no drugs, there's therefore no side effects, and there's therefore nothing intrusive, no chemical transformation. It's the procedure, you're done, and as a viable first line of care, if you will, it's worthy of consideration for those very reasons, right? It sounds like low risk, high reward. Give it a try.
Definitely, yeah. And also we've noticed that like acupuncture along with certain medications, the benefits are greater than acupuncture alone or the medication alone. So with that, then reducing medication but still
Right.
having
So
it,
So it's so it sounds
Mhm.
like an ideal combo. So you could consider it first line, and if necessary, supplement with medication. And then conversely, you can consider it second or third line. So you start with the medications, and to preclude the medication getting a little bit out of control, to some of the
Mhm.
points I was making, in addition to just providing a viable booster, if you will, to help those medications along and provide additional relief. Acupuncture could enter as a second or third line of care as well.
Definitely. And the other component that I think patients really appreciate is that we are touching arms and legs. We are doing manual therapies like releasing muscles and putting needles in, like people feel taken care of by a physician, like they feel heard. And I never come from a place of criticism with Western doctors. because they have the time that they have, and their work is a lot in the labs and giving you the right amount of medication. But we have the time. We have that's part of our medicine, is listening, putting our hands in their shoulders and giving them a treatment where they have to be still for 15-20 minutes, which that, even if it's not the intention, that becomes a stress reliever. And also acupuncture, because of its effect to the nervous system, besides being relaxing, it also uh, releases endorphins. So people naturally leave acupuncture happier, as if they were just working out.
Yeah, that's a great point, because most people's experience at the doctor is terrible. And the biggest reason is that the doctor isn't looking at them, the doctor is looking at their EHR
Mm-hmm.
screen.
Yep.
And the patient is talking, and the doctor has minimal to zero physical, ironically, minimal to zero physical interaction with the patient most of the time. They might take an instrument to do an evaluation or a test or a measurement, and there's very little direct contact between physician and patient. And there's very little conversation outside a mere verbal description of symptoms. And then the doctor scrolling through the EHR, looking at the codes and worried about the insurance. So the experience of patients, Western patients, for a long time now is mechanical, is not particularly empathetic. And what you're describing is an inversion of that model. An acupuncturist, by nature, in terms of doing what they need to do, is touching a patient, is making a human connection. And as you also say, there's a lot of conversation that have to do with other aspects of the patient's life, which conceivably and necessarily impact the physical health and well-being of that patient.
Yeah, yeah, and that is one of my favorite things about this medicine. Because I love medicine. I would love to have both degrees. But I think I will always choose to do acupuncture because of this reason, because of this connection and this automatic care that patients leave, and they live with the headache that it was an 8 out of 10, and now they're living with a headache that is at 1 out of 10, and they're happy. So I I I get a lot of relief from that. And even if I've been in practice, I was in school for 8 years, and I've been in practice for almost 8 years, and I still sometimes am, how does this work? When the cases where people get up and they're not in pain or less pain, because it's not a magical treatment. It's not that I'm taking pain away, because that's not the way acupuncture works. And we can talk about that in a moment. But sometimes we get impressed too of how like efficient and how real it really is. And that is the beauty of Eastern medicine, is that because you are paying attention and spending time, where touching a patient and actually feeling how their bodies are doing, you are like, of course, this is going to help them. And that's a really good feeling that I continue getting over and over.
Yeah, I think that's wonderful. In my own personal experience, I had terrible migraines as a child, really at the cusp between boyhood and adolescence, around age 9, 10, 11. I had terrible migraines. And I went to the doctor. And the doctor never once asked me, well, what's your diet?
Mm.
Are you exercising at all? What factors in your life might be contributing to the pain that you feel on this recurring basis? There
Mhm.
was nothing like that. There was just a series of tests with results, and it did nothing really to overcome my ailment. And the only thing that finally healed me was entering adolescence. It was probably a hormonal issue that was exaggerated by eating a high sugar, horrible diet and not getting enough exercise. So, from a personal vantage point, I can relate to just the paternal, clinical, almost inhuman approach that's taken. This is not knocking doctors. Again, this is just kind of Western process. They're forced into this bureaucratic system, and this interpersonal relationship, giving good patient, so to speak, is starting to become a facet of medical schools, but it's frankly, I think, long overdue as well. It's all about the science and less about the person.
Yeah, definitely. And one of the things acupuncture has that I think it adds to the skepticism is that acupuncture has a very small clinical validity in internal, but very high clinical validity externally. So our clinical results are amazing, but it's hard to prove in a lab. So this is something that we struggle in when people ask, well, how does it work? And there are studies um, showing that it does work. And also, it's done in animals who can't fake it.
Right,
Um, and but it's hard for us to get in a lab and show margins that are satisfactory consistently. So maybe that's something that the acupuncture and Chinese medicine world can try to change. But I think the nature of our medicine is very clinical. It's like this works with this individual, is this part of the connection, is part of the recommendations. Just like you said, sometimes I have patients that are complaining about hot flashes, and I ask, and they eat super spicy food every day, and I'm like, how about you stop doing that, and their hot flashes go away.
right. Healing is healing, right?
Healing is healing, yeah.
Yeah. So, as you were intimating before, roll your sleeves up and take your needles out. Let's click down into one more detailed level of how you do what you do. If you could share some of the cases that might be memorable, relate what it's like to get treatment, and convey your enthusiasm, but also the efficacy and validity of considering acupuncture as that viable second option, and even more importantly, consider it even as a first option.
Yeah, definitely. Well, something that I wanted to touch in before I explain this is that acupuncture works in a series of treatments because we are changing a pattern in the nervous system that has been there for a month, 3 months, years, a decade, 2 decades. So that's something that people a lot of times misunderstand. They come for one treatment, they don't get better, and then they think acupuncture doesn't work. Whereas most of the time, it takes about 5 to 6 treatments to treat something acute, and then 6 to 12 treatments, maybe a little more, for something chronic. If you're walking in with an injury that you had 20 years ago and expecting acupuncture to heal or alleviate your pain in 1, 2 sessions, then that's not the way it works. So I have a few really memorable experiences. One of the first is my first very skeptical patient. Um, that was my dad. And I know this might be like a dad-daughter moment, but my dad never really believed in acupuncture. He always supported me in school, but he never really believed how it worked or if it worked at all. And he had elbow pain, and I asked him to let me treat him, and I treated him, and his elbow pain was gone, and he became like an advocate for acupuncture because in his eyes it right, like he could feel the difference. That was like my first time where I was like, wow, this really works, and he did too. But I had a patient. She's not my patient anymore because we solved her issue. She had rheumatoid arthritis, and she had a lot of trauma. And I worked with her weekly for 2 years. And we would do half sessions counseling and half session acupuncture. And we reduced her pain from not being able to walk easily to now she plays pickleball and she's having a full social life. And I learned so much with this patient of how much the body holds on when you have emotional trauma. And changing her diet and weekly acupuncture treatments changed her life completely to the point where she didn't need treatments anymore.
Oh, those are wonderful, evocative stories, and they also illustrate your approach, which is the entire person. not just sticking needles into them, but getting to know them, asking questions, and providing emotional support too. That you're there for them, you care about them, you're listening. And I would guess that part of the healing effect is just having someone who cares in
Yeah.
their life. I remember going to a chiropractor years ago, and this guy was prided himself on, and this is nothing against chiropractors, but I just want to illustrate a counterexample where I would go in there, and his big goal was just to get the crack. And
Mm.
I would lie there, and I had a pinched nerve in my neck, and he would get the crack. So sometimes the procedure would be 10 minutes. I would lie there and he would stretch and pull and then suddenly yank and there'd be a big crack. And then he would shout out, "Got it!" And that was it. He didn't ask
Mm.
me how I was doing. He didn't inquire if even I was making any progress with my pinched nerve and pain in my left arm. He was into getting the crack.
Mm.
And a lot of physicians, through my own experience, have been just trying to get the crack, which is just some immediate response or some kind of cycle of treatment where you do this and then you get that, rather than actually caring about the patient in a broader sense. And to your point, treating them over time,
Yeah.
which is getting to see them develop and grow and change in their healing process.
Definitely, definitely. I think we, this patient and I, like grew together. You know, we spent 2 years weekly sessions. She's, and I just saw her life change, and I was just impressed of, the amount of benefits she got. Um, there's a few great things for acupuncture is kids and things that are acute that just happen, like maybe 2 months old injury. These are the easiest things to treat. Not that kids are things, but they heal really fast because kids are, they have less trauma, they have smaller bodies, they have more energy. um, and kids, pediatric acupuncture is fantastic. I did my one of my offsite clinics in Radies Children's Hospital in San Diego, and the experiences I got there were amazing. Like kids that were in a lot of pain or nausea from treatment, and we will walk in with our needles and offer them treatment, and those who said yes really got a lot of benefit. Um, and that was a really beautiful experience. It's not easy because seeing kids in pain is really difficult, but they really, really got better, and it reminded me of my own experience with acupuncture as a kid.
Yeah,
And
that's inspiring. It's inspiring. Can you share maybe a few resources or go-to places so anyone listening to this, especially if they're experiencing acute or chronic pain or other ailments, they might have tried other therapeutic journeys. And many people are just curious about acupuncture as a viable option. We could share the links in the description of the podcast. But can you talk about a few resources that you found really valuable, maybe a few that you offer to your own patients in terms of background, getting folks familiar, showing some of the possibilities?
yeah, definitely. Well, I have my in my website there is a blog where I talk a little bit about acupuncture and a little bit of nutrition. So my website will be a good resource for getting acupuncture and finding who is close by. I recommend asking their insurance if it covers acupuncture, because then that would be an easy way to find a practitioner that is covered already.
Yeah, you beat me to the punch because I was going to ask about managed care. It's really in healthcare, especially these days, it's all about coverage and expense. From your experience, how well is acupuncture covered?
Yeah, so this is for patients is great because I think it covers twice a month for 6 sessions.
And it'll depend on the carrier. So
Yeah,
obviously, first they need to go and check their insurance carrier.
Yeah, definitely ask insurance.
And it'll vary. No doubt vary based on their plan and based on their carrier.
Yeah, so private practice is more expensive. I think if you know someone who has a good acupuncturist, word of mouth will be the best. There is a lot of practitioners out there, just like there is a lot of doctors right there out there. So you might find a wonderful acupuncturist, and you might find one that you don't like, just like doctors. So keep trying. Like if you don't like someone, go to someone else. Pay what you're comfortable with. So it ranges from $20 per treatment in a community acupuncture setting to $200 per session. So you have to kind of see what resonates with you. But now insurance is covering acupuncture, and this is how I ended up working at a health center, because I don't want to take insurance in my personal private practice, but I would love to help patients who want to use their insurance. So I get a little bit of both words. So yeah, you can ask sometimes your medical doctor or your primary care will have a recommendation for you. So we are trying to network on our side. And then really as easy as Google and Google reviews. Find someone local and read their reviews online.
Terrific. That's very, very helpful. And in terms of just general education resources, aside from Googling acupuncture and reading the Wikipedia article, are there any particular resources that are, in addition to your own website, a good place to learn a little bit more about acupuncture?
Yeah, there are books for people who don't have background in Chinese medicine to kind of understand the medicine. If you like to read, there is a book called The Web That Has No Weaver. It's one that they recommend in school before you start school, just to learn a little bit more. And yeah, I'll think about more resources. Right now, at the top of my head, I actually
Great. No,
don't
I don't mean to put you on the
have.
spot, but we'll put all the ones in the description. So
Wonderful.
this is terrific, and I know health and wellness impact all of our lives. The healthcare system is $3.5 trillion in the United States alone, of which a minuscule percentage, I believe, is spent on acupuncture per se. I think it's out of proportion to the acknowledged benefit of acupuncture. And I want to personally thank you for jumping on this podcast to educate and hopefully excite folks about the possibility of integrating acupuncture into their broader health regimen, whether they have an acute or chronic ailment, whether they're put into position where it becomes a potentially viable source of treatment. I think this is great information. It's a good reminder that you not only exist, but there are many, many thousands of acupuncturists who are poised to really supplement the care that you're getting and really make your life better in terms of this effective style of treatment that we could thank half the planet for and appreciate that it's long overdue in terms of integrating it with our proven Western practices. But to your great point, it's really yin and yang, quite literally, right? Bring the two sides together.
Definitely, yes. Thank you so much for the opportunity. This was very fun.
Okay, thanks for having us. That's another episode of the No Hair, All Heart podcast. Check the references, and Dr. Alex will leave her personal contact information too if you want to reach out and ask any questions. Thanks so much, Doc, for joining us.
Thank you.
Thank you. Bye bye.
Bye.